Vitamin D, the nutrient that can harm you if you overdo it. We often hear about the dangers of not getting enough vitamin D. But what if taking too much could be just as risky? That's the surprising twist most people miss. Vitamin D has surged into the spotlight in recent years, and for good reason. A lack of this essential nutrient has been linked to a wide range of health issues, from weakened bones to chronic illnesses. And here's the kicker. A significant portion of the global population isn't getting enough. A century of discovery. Since scientists first mapped out the chemical structure of vitamin D in 1930, research has steadily uncovered its many roles in the human body. Early studies focused on how it helps regulate calcium and maintain bone health. But things got more interesting in 1968, when researchers identified two key metabolites, 25-hydroxyvitamin D, 25-OHD, and later 1,25-dihydroxyvitamin D. These discoveries opened the door to exploring vitamin D's influence on the immune system, infections, cancer, and chronic conditions like heart disease, obesity, and type 2 diabetes. Today, there's no doubt that vitamin D is a major player in immune regulation. In fact, low levels have been associated with worse outcomes in COVID-19 patients. The deficiency epidemic. Here's where things get alarming. As of 2020, nearly 40% of Europeans, 24% of Americans, and 37% of Canadians were found to be deficient in vitamin D. That's not just a statistic, it's a public health crisis. Vulnerable groups include pregnant women, children, older adults, people with obesity, individuals with darker skin tones, and anyone who spends little time in the sun. Our bodies can produce vitamin D naturally through skin exposure to sunlight, converting cholesterol into the vitamin. But how much sun is enough? That depends on several factors. Season, time of day, geographic location, age, and skin pigmentation all play a role. Experts from the Spanish Society for Bone and Mineral Metabolism Research suggest that fair-skinned individuals should aim for 15 minutes of sun exposure on the face and arms daily from March to October. For seniors and those with osteoporosis, 30 minutes is recommended. And yes, sunscreen is still important. SPF 15 to 30 is advised, depending on UV intensity and latitude. Diet also matters. Foods rich in vitamin D include fatty fish like salmon and trout, full-fat dairy, margarine, and fortified plant-based drinks. But here's a twist. Modern health habits, like frequent sunscreen use and low-fat diets, may be contributing to the deficiency. Should you take supplements? To measure vitamin D levels, doctors typically check the concentration of 25-OHD in the blood, but results can vary depending on the testing method. For most people, levels above 20 nanograms per milliliter, ng per milliliter, are considered sufficient. Those over 65, or individuals with bone disorders, or on long-term medications like corticosteroids or anticonvulsants, should aim for levels above 30 nanograms per milliliter. Levels between 12 and 20 nanograms per milliliter are borderline, while anything below 12 nanograms per milliliter is classified as deficient. But here's where it gets controversial. What about people whose levels are already adequate? Should they still take supplements to boost immunity? A 2022 meta-analysis looked into this, examining the effects of daily doses between 1,000 and 2,000 international units, IU, in healthy individuals. The findings? No significant improvement in immune function or protection against respiratory infections, flu, or COVID-19. However, other studies suggest benefits for people with existing respiratory conditions, especially those who are deficient. The evidence is mixed when it comes to metabolic and neurodegenerative diseases. The dark side of oversupplementation. Getting too much vitamin D from food is rare, but overusing supplements, especially without medical guidance, can lead to serious health problems. Taking more than 4,000 IU per day over extended periods can push blood levels above 50 nanograms per milliliter, increasing the risk of toxicity, known as hypervitaminosis D. The most common symptom? Hypercalcemia, excess calcium in the blood. This can cause nausea, vomiting, constipation, fatigue, and weakness. In severe cases, it may lead to excessive urination and thirst, kidney failure, abnormal calcium deposits, depression, confusion, bone pain, fractures, and kidney stones. And it's not just theory. A 2016 report from the U.S. National Toxicology Data System showed a dramatic rise in vitamin D toxicity cases, from an average of 196 annually between 2000 and 2005 to 4,535 in the next 5 years. Proceed with caution. The buzz around vitamin D is understandable. It's linked to many health conditions, and deficiency is widespread. But here's the part most people overlook. Taking supplements without a real need can be harmful. Yes, supplements may help those with deficiencies, particularly in reducing the severity of respiratory illnesses. But for others, they could do more harm than good. So what's the takeaway? Always base your decisions on solid scientific evidence. Don't assume more is better. And if you're considering a supplement, consult a healthcare provider first. Is vitamin D really the miracle nutrient some claim it to be? Or are we overselling its benefits? The science is still evolving, and there's much we don't yet understand. What do you think? Should supplements be reserved only for those with proven deficiencies, or is there a case for broader use? Share your thoughts in the comments. Let's open up the debate.